cephalopelvic disproportion. What is it? So if the baby's head fails to pass through the maternal pelvis, that is considered to be cephalopelvic disproportion. If the biparieto sub-occipitobrachmatic angle, that is during bardic preservation, there is sub-occipitobrachmatic diameter, and largest transverse diameter is biparietal diameter. If the diameter fails to pass through the bispinous and anteroposterior planes of the outlet, that is called cephalopelvic disproportion. So what can be caused? Either the pelvis is small or baby's head is too big. So what could be the cause of pelvis becoming small? That is contracted pelvis. Basically the cause is of pelvic contracted pelvis. Contracted pelvis we have discussed previously. Then another cause, baby head becoming too big. So causes can be macrosomia, hydrocephalus, sometimes asynclitism, and occipito-posterior position can also cause cephalopelvic presentation, disproportion. So how to examine for cephalopelvic disproportion? One is clinical pelvimetry. Clinical pelvimetry to examine the pelvis. Second is cephalopelvic disproportion examination. So how is done? We will go for that, but before that let's go into diagnosis. It can be done by imaging, uh, telemetry, like by MRI, CT, but it is not usually done. But head size can be examined by doing anterior ultrasonography. So management: minor disproportion, vaginal delivery; moderate is trial of labor; and major is major, or if trial of labor has failed, then cesarean section is done. So how to examine for the cephalopelvic disproportion? What is mild, moderate, or severe? So there are two methods: abdominal method and abdominal vaginal method. So abdominal method, what is done we will tell. It is classified after finding, it is classified as no disproportion, slight disproportion, and severe disproportion. Abdominal vaginal method, it is also classified as no disproportion, slight disproportion, and severe disproportion. So what is done in abdominal method? So in abdominal method, the head of the fetus which is not engaged is attempted to push down into the pelvic cavity using one finger, and another hand's uh, radial aspect of the index finger is kept above the pubic symphysis. Then the head is pushed with one finger, one hand, with left hand, and with the right hand the index finger is placed on the pubic symphysis of the mother. So if we push down, if there is no contact, if there is no touch with the uh, if there is no touch with the finger, then that is no disproportion. The baby's head can go easily in. Second, slight, if 0.5 centimeter overlapping is there of the head and the finger. Severe, the head cannot be pushed down. Abdominal vaginal method. So here what is done is, with one hand, like left hand, the head is pushed down, and another hand, vagina, inside the vagina, a finger is placed nearby the pubic symphysis. And then if head can be pushed down to the still spine and there is no overlapping of the parietal bone over symphysis pubis, then that is considered to be no disproportion. If head can be pushed a little but not up to still spine, that is slight overlapping, then there is slight. If severe disproportion is there, then head can be pushed down and there is overhanging of the parietal bone. So what can be the complication? Complication can be fetal distress, because head getting compressed, mm, delay in the labor, obstruction of the labor. There can be uterine rupture due to excessive contraction and obstruction of the labor, and there can be birth canal injuries because the baby's head is too big. CPD means baby's head and pelvis not becoming proportional to each other. So that is about cephalopelvic disproportion. So thank you.